We had an America First candidate, have an America First president, and it shouldn't surprise anybody that we have an America First budget.
Nonprofits across the country are bracing for tough times. Deep budget cuts in domestic programs will pay for a $54 billion increase in military spending, and a new restructured tax plan will likely hit nonprofits very hard. What health and human services programs could be impacted locally? Tonight's live broadcast and live stream of Insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Daryl Huff with Hawaii News Now. America First, the Trump administration's budget proposal calls for big increases in military spending, veterans affairs, and national security while planning tax cuts that would reduce revenue. That may lead to deep budget cuts elsewhere that could have profound implications for Hawaii's nonprofit and charitable sectors. How will President Trump and Republican lawmakers' fiscal priorities impact Hawaii's safety net for the most vulnerable in our community? And is Hawaii's charitable sector ready to respond? We have in our studio tonight representatives from Hawaii's nonprofit community to address those concerns. And we look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. Now to our guest. Micah Kane is the president and CEO of the Hawaii Community Foundation. The foundation, nearly 100 years old, distributes $40 to $50 million each year to community nonprofits that serve children, elderly, educational, and research efforts. Mr. Kane is also currently chairman of the Board of Trustees for Kamehameha Schools. Gavin Thornton is co-executive director with the Hawaii Appleseed Center for Law and Economic Justice, a nonprofit law firm created to advocate on behalf of low-income individuals and families in Hawaii. It takes on civil legal issues of statewide importance. Dave DeRoff is physician and executive director at Kokua Kalihi Valley Clinic, a nonprofit corporation formed by the Kalihi Valley community in 1972. The clinic provides accessible and appropriate healthcare services for the valley's low-income Asian and Pacific Island immigrant population. More than 10,000 community members are served annually. And Tricia Kehaulani Watson is the executive director of Honua Consulting. She founded Honua Consulting in 2003. It specializes in nonprofit organizations, environmental and cultural assessments, facilitation, strategic planning, community consultation, and mediation. Now let's start off with you, Tricia. What are you hearing about what's coming down the pipe in terms of the federal budget and how it might affect?
Well, I think it's important to focus on what President Trump is saying versus what is actually happening. So about a year ago, he really proposed deep cuts. They actually didn't happen. So he really proposed that the sky was going to fall. It didn't fall a year ago. We're seeing that again. So I have been in contact with Senator Schatz's office, and again, we're seeing that he's proposing very deep cuts, yet people need to remember that the budget isn't actually under the purview of the president. It's under purview of Congress. So fortunately, we really do have great senators who have proposed to respond with budget cuts that aren't as deep as what the president is suggesting. So I think people really need to wait and see if what Trump is proposing is actually going to result in as deep cuts as the president is going to say, because we didn't see that, when he first came out a year ago. At the same time, I think people do need to brace. People also need to remember that there were deep cuts during the Obama administration as well. So what people need to prepare for is their own resilience. Hopefully, nonprofits, especially larger ones, have diversified their revenue streams. So people shouldn't be preparing for just grants alone. They need to really be diversifying what's coming in. They should be, I think HCF and others have really good philanthropic partners, so you're not just preparing for government grants. Any good large nonprofit is going to have also private foundations, yes, different sources of revenue. So you're going to have private partners, you're going to have different charitable partners that give to you, so that in the event that there are cuts, which hopefully aren't as deep as Trump is proposing, you're able to take those hits and move on.
Dave DeRoff from I always want to say Kalihi Valley, but that's the other one.
No, that's us.
That's you, okay. In the healthcare field, though, there's a lot of talk about big changes there, right?
Right.
You are bracing for something quite serious there. And how much opportunity do you have to diversify revenue sources? It's pretty much government.
Well, so on the medical side, medical, dental, behavioral health side, we have dodged a couple of bullets already, as we saw. Dire predictions that Medicaid was going to be slashed already, and that didn't happen, fortunately. But I think everyone still suspects that these tax cuts will be used to fuel the need to further slash Medicaid, Medicare. We're hearing about a package of $1.5 trillion over 10 years, resulting in an extra 20 million Americans being uninsured. So in the federally qualified health centers receive federal funding for their base operations from the federal government. That has strong bipartisan support so far. But the lion's share of our revenue still does come from the Medicaid program. And so any significant cuts to the Medicaid program will be really damaging to America's community health centers, which are the safety net for millions and millions of Americans. In Hawaii, we serve about 10% of the population here.
Gavin Thornton from Appleseed, you guys do keep quite a lot of tabs on what's going on in Washington. What do you see ahead?
Yeah, I think for a lot of folks, it's a scary proposition. The money that the federal government provides to the state for human services programs and the like is really significant. I think the state gets about $3 billion from the federal government, which represents about 20% of the state's budget. I mean, even a 10% cut to that is going to be really hard to absorb. So, I think diversification of funds for nonprofits is great, but I think that only goes so far. And what we really need to do, I think, is to come together as a state and figure out how are we as a community and a state going to deal with this.
Mike Akane, at Hawaii Community Foundation, you deal with a lot of individual nonprofits. How ready do you think that they are, and what do you think might be the impact of the changes in Washington?
Well, I think what concerns us is that the current nonprofit community is not meeting the current need right now, and so any kind of cut. And I think it's fair to try to run through scenarios to try to understand what kind of impacts and to start to prepare. We brought 200 of the nonprofit community members together in August to have a sit-down session to start thinking about how we can advocate around one voice and start rethinking about not letting Washington drive our agenda, but think about what we can do here in our community to start prioritizing, start looking at issues around healthcare, specifically the issues around Medicaid, I think got a lot of attention, and looking at the most vulnerable individuals first and start prioritizing.
It's interesting that you mentioned how the things that the president would say then get buffered by Congress, and then stuff hasn't happened. But I'm going to go to a clip now to talk a little bit about that. By approving this budget blueprint, the House and Senate are hoping to have an easier time pushing through some of these tax cuts, like the $1 trillion tax cut and overhaul the tax code and the budget. But the final 2018 budget allocations won't be approved until late this year or early next year. PBS NewsHour broke down the winners and losers in this 2018 budget when it was first released by the White House.
Much more for the military, much less for many domestic and international aid programs. That is the upshot of President Trump's first budget, unveiled today. John Yang begins our coverage at the White House.
It runs just 53 pages, totals more than $1.1 trillion, and embodies stark changes in federal spending priorities. Budget Director Mick Mulvaney.
We had America First, an America First candidate, have an America First president, and it shouldn't surprise anybody that we have an America First budget.
The big winners in the White House budget request, the Pentagon with a proposed 10% increase, $54 billion. The The Department of Homeland Security with a 7% hike, including $4 billion for the Mexico border wall. And the Department of Veteran Affairs proposed to increase by 6%.
We're $20 trillion in debt. We're going to spend money. We're going to spend a lot of money, but we're not going to spend it on programs that cannot show that they actually deliver the promises that we've made to people.
The biggest losers would include the Environmental Protection Agency with a proposed 31% cut, eliminating funding for international climate change programs and for cleanup efforts in the Chesapeake Bay and Great Lakes. The State Department would be cut 29%, mostly foreign aid and UN peacekeeping. And the Department of Health and Human Services is being asked to take an 18% cut. While the White House wants Congress to cut Justice Department spending by 4%, it wants more money to target criminal organizations and hire immigration judges at the expense of civil rights programs. In Tokyo, Secretary of State Rex Tillerson said the proposed cuts in his budget are fine with him.
Clearly, the level of spending that the State Department has been undertaking in the past, and particularly in this past year, is simply not sustainable.
President Trump tweeted that his budget proposal puts America first, must make safety its #1 priority. It represents the biggest military buildup since the 1980s and the most sweeping reductions in other spending since World War II. Democrats immediately condemned the budget request. House Minority Leader Nancy Pelosi said it takes from the middle class and gives to the rich.
This budget is not a statement of values of anyone. That President Trump has shown that he does not value the future of our children and working families. This budget is really a slap in the face of the future.
Overall, the administration wants to eliminate funding for 19 agencies, including the National Endowment for the Arts, AmeriCorps, and the Corporation for Public Broadcasting, a major funder for public radio and television. Other points of contention are likely to be calls to eliminate community development block grants and cut billions of dollars for teacher training, after-school and summer programs, and almost $100 million from the Rural Business and Cooperative Service.
Now, Tricia Watson with Honeywell Consulting, there was a statement made in that tape about not giving money to programs that haven't been able to show results. The nonprofit sector has already been, for years now, been forced to show and prove more outcomes over and over again, right? Is that cultural change already there? Is the nonprofit sector delivering on its promises?
I think it absolutely does deliver on its promises. And so, again, I think you have to separate from the rhetoric of this administration. And again, I think you're going to see that Congress is going to put a significant amount of this money back in. So there's the budget that comes in from OMB, and then the budget that goes to Senate, and then the House, and then the Senate. So a lot of this money is going to come back in, and then it's going to be what gets negotiated and what budget actually gets passed when the CR comes up in December. So, and then if there's another another continuing resolution that kicks the can down the road. So I think, again, the budget is so confusing and this process is a little ridiculous that it's really hard to follow what actually gets passed. So we already know that our delegates, and again, we have great congressionals that are going to be able to put a lot of this money back in. So it's hard to look into the crystal ball and see what's actually going to get passed. So at least I know for the environmental sector, I think the cuts are not going to be as dramatic as we think they're going to be. And so I think we have to, again, still prepare. One, I do think all these nonprofits deliver. And at the same time, I think we have to be thinking of two things. One, diversifying again, and I think that means talking to the private sector. I think it also means monetizing what the services nonprofits provide. I don't know how much that applies to the health and human services sector, but it certainly applies to the environmental sector. And then thinking about the fact that as long as the economy is healthy, people give more. So
let me. I don't mean to interrupt you. Sorry, but there was you mentioned the group you got together to talk about this future, and there was a quote. It was sort of a reminder statement that you and Kelvin Takeda, who was also at the Community Foundation at the time, put in a joint statement is what is important to note is that in Hawaii, as well as across the nation, the nonprofit sector's single greatest source of revenue comes from the government in the form of grants and contracts. Since the 1960s, we have seen a steady devolution of services that used to be provided by government, now in the hands of nonprofit agencies. Can you explain a little bit more about that, what that means, and what that means about the role of nonprofits in our culture as a safety net?
Well, it's clearly saying that we're very dependent on the services that the nonprofit community is providing. I mean, today we represent 11% of the workforce in the state of Hawaii. That's a large population of people, and that's a lot of dependency on providing services to the needs of our people. You know, when you look at the nonprofit community as a whole, there's a little over 5,500 nonprofits, of which we're most dependent on about 1,200 of those nonprofits. Those are the nonprofits that are bringing in more than $100,000 or more in revenue. But where I think our biggest concern sits is in the lion's share of revenue, which comes in the healthcare arena, primarily through Medicaid. And those are our hospitals, those are our universities, those are the ones that I think we're paying most attention to right now.
You know, we were talking about, earlier, we were talking about how the different nonprofits sort of fit together. Many are fairly small, many are larger, but, you know, how does that work, David Roth? Do you think that, like in your organization, if you could be as specific as you can, what other nonprofits are hooked into your nonprofit, you know, in order to make sure that an individual is getting the help they need?
Yeah, it's an incredibly vibrant network, and I think we're really fortunate in Hawaii to have a terrain in which people are good at working with one another by and large. I don't have the sense of a lot of competition for services as much as collaboration. And so typically most of our programs are interacting with as many as 20 or 30 other nonprofits to deliver the services that they do. But I think that's an incredible opportunity for us too. I think, you know, one of the things we realize here in Hawaii is that we're a place that's blessed in many ways with incredible gifts, and the gifts of the nonprofits vary tremendously too. We don't always understand what each other are good at doing, and when we can sometimes pull them in as partners and share funding and share how what we value. I mean, that's the more important thing. And it's so easy to get caught up right now at a time like this when we're looking at the federal budget and the kind of craziness that's going on there, get caught up in that craziness and not think long term. You know, if we're going to continually be in this reactive mode, I think we're going to fail to seize this opportunity to say, what is it we in Hawaii really value? What's important to us? And the nonprofit sector has a really important role to play, I think, at getting that conversation down at the grassroots and hearing the voices of people throughout Hawaii. I think we're good at that. I think in fact we're much better than that than very large, the government sector or large corporations.
You know, that's an interesting point, and let me bounce it off of Gavin, is, you know, when we talk about the movement of services from government to the nonprofit sector, I mentioned the nonprofit sector would argue that that's great, but at the same time you get a lot less money to the nonprofit sector than you were spending in government before. I mean, it was a budget cutting process that led to where we are. How is it that the nonprofit sector operates better or more efficiently than government would? Or should some of these programs be government programs?
Yeah, you know, that's actually not an issue that I've spent a lot of time looking at. I mean, I think we have a lot of nonprofits that run very strong, efficient programs. Some of that migration from the government to the nonprofit sector has definitely occurred as a matter of efficiency. You know, the government is capable of running very efficient programs that work well. And we just haven't spent much time really digging into, like, does the current mix make sense? I wanted to play off of something that David mentioned about this is an opportunity, because I think there is, you know, the danger of people, you know, running for the exits, being really scared about what's happening in DC, but I really do see it as an opportunity. in some ways, it kind of frees the shackles for Hawaii. It allows us to look inward and say, we are a unique state. We have a lot of really great things going for us, and use the urgency of these changes, these potential changes, to really get us to pull together and figure out what can we do more efficiently, or is our own state budget aligned with what our values actually are as a state? What can we do to build off of this situation?
You know, I did get a question from a viewer that goes to this point, and I'll put this to you, Mike Akani. Is there much redundancy of services by not-for-profits in Hawaii? Could savings be made by eliminating these? How is it that this works, that they're not laying on top of each other, duplicating services, that they somehow are matching up or dividing up the labor?
Well, I think on a per capita basis, we're consistent throughout the country. I mean, we're about average. And as I stated earlier,
Average for what?
On a per capita basis, we have about the same amount of nonprofits as you see across the country. It's fairly consistent. Amongst those 5,500 nonprofits, only about 2,000 of those nonprofits actually file a 990, and that's where you can get the data from.
But there's about 5,500 nonprofits in Hawaii,
of which only about 2,000 file a 990.
and does that include like a Boy Scout troop or some other thing, or is this most of the social services?
So most of the higher performing nonprofits are required to file a 990 in order to get funded from major funders, whether it's a federal, state, or
that's the federal tax form that you have to file to keep your
That's
nonprofit
correct.
status and
That's correct.
tax-free.
Yeah, that's correct. In terms of redundancy, we're starting to see, as Gavin said, a willingness to actually come together and to evaluate ourselves. We did a program 4 years ago called Housing ASAP. We brought together 13 funders. It was a $4 million initiative. We worked with 8 service providers in the homeless community, focused on the families, and our goal was to move more families faster into permanent housing. And we saw tremendous progress there, and it was done by working together, and tremendously successable.
How, Tricia, you must know something about how the nonprofits keep from bumping into each other and collaborate with each other. Could you give me some examples of how that's worked?
Well, I think it really depends, kind of like what Micah was saying, at who you're talking about at what level, right? I mean, so you have the larger, high-performing nonprofits that I think do collaborate very well, and then I think you have smaller nonprofits that I think are just coming off the ground. And I think the ones that are smaller sometimes do bump into each other. I think there isn't a lot of collaboration there. And I think those are the ones that are likely to get hit by any cuts more. Those are kind of the grassroots guys. I think it's...
Let me ask, so how does a nonprofit often get started? When you talk about a small nonprofit, is it usually just a few people to get together and they see a need and they say, let's get together and form a nonprofit. We'll do it in the barn. We'll sell tickets. Is it?
I don't know how many barns we have left in Hawaii, but yeah. More or less, yeah. And I think... But yes, and I think that's really kind of the wonderful thing about Hawaii is we have a lot of people who do kind of just hui together and see a need and come together. And I think that's potentially where opportunity lies a lot of the time is we come from a state where people see a need and dive in. And I think maybe that some of the opportunity here is there's going to be, in this gap, opportunity to dive in and help. And I think as we're going to find ways to create opportunities to come together and rally together to fill more and more gaps. And I think that's perhaps what needs to happen on a larger level, on a statewide level right now, is how do we pull resources together to make sure that those gaps don't widen. So instead of people because I think people oftentimes romanticize nonprofits. I think they think, and maybe that's the wonderful thing about what's happening right now is that people will realize that government grants aren't the be-all, end-all, that they're going to find that there's new ways to help, there's new ways to get involved, there's something else. And I think that's where organizations like HCF really are critical in all of this, is that they can find new points of entry. So there's not this constant bumping into each other at the lower levels, and instead they can get involved with some of the higher performing nonprofits instead.
Right. I mean, the one thing I would say, Daryl, is, because your question seems to be focusing on whether we're efficient organizations, and many of the fledgling nonprofits start out as entities that are doing good work in their communities long before they receive a dime of funding. Oftentimes, this is people who are working another job and then doing this work in their spare time before they move on to it. That doesn't mean there isn't an opportunity for us to partner together for example, if you're a mom and pop nonprofit, it's really hard for you to do things like human resources and all the documentations that's necessary, keep the insurance policies, all that, the payroll, all that stuff is not what typically people who start small nonprofits go into it to do that well. There is probably an opportunity there for us to hui together and figure out a way to support those small nonprofits so they can be more efficient and effective at those things. But ultimately, I don't think we want to say that value is purely an economic consideration either. I mean, I think we live in a place where people have a strong set of values that isn't principally one governed by economics. It's governed by how well we take care of each other and how well we take care of this place. And that strong set of values needs to be factored into the equation when we talk about efficiency, I think.
I've got another question here. Can anyone give an example of how much improvement has been made in the actual results achieved by spending the money? I'd like us to get sort of specific with some stories, Sure. Let me start, anyone can throw this out. I'd love to hear from you guys a couple of examples of a story of a nonprofit that grew into a really important factor.
Well, I think right now, one example is the Kupu Foundation. This was a dream by two young people that was inspired by conservation, and they used their passion to get into conservation, to mentor kids and create one of the most efficient, productive, impactful internship programs for young kids in the state of Hawaii.
And we've hired a number of the interns, and they're well trained. They come to work, they hit the ground running.
So tell me the story. How did it get started? How did?
No, it started out of someone's passion to do this kind of work, to saw that there needed to be more opportunities for young people who wanted to give back in their communities, and that you could really organize that in an efficient and effective way.
And it's amazing how much thirst there is in the communities to support organizations like that. This community steps up big when they see that kind of impact, and this organization specifically is not only having deep impact, but it's reaching the kids that would be falling through the cracks right now. And that's two people.
Well, I did their governing docs, so I can probably help with the story. So it started as a for-profit. They started with Pono Pacific. It was a husband and wife, and they started as a program. They started as a program with DLNR. They started as the Hawaii Youth Conservation Corps, and so that was a government grant that became its own 501c3. And so that actually is a great story of one that diversified and became a 501c3, and is one that's actually a perfect example. And they're perfect example. So another one that's very similar to them is Papahanaukua'ola, because I did theirs as well. So I think there's very good examples of local nonprofits that are for-profits and nonprofits that diversify, that have wonderful cultural and economic resilience, that have grown into very high-performing nonprofit organizations, that have businesses and nonprofits that work side by side, that take care of environmental and cultural needs, that are very strong on the business front, on the grants front, that diversify, that really can weather pretty much any storm, but do really great work in the community.
Gavin Thornton, you got your start in legal aid, which is nonprofit, and legal services are a big issue. Are there a variety of nonprofits that are helping people dealing with problems that are legal problems, landlord, tenant, those sort of things? Is that a healthy part of the nonprofit community now, and is that an important part?
Yeah, definitely an important part. I mean, access to justice, people that are on the verge of eviction, people that are struggling with family matters. Definitely an important part. One of the housing ASAP example that Micah mentioned earlier, I think is a great example of how we've gotten more efficient. Groups of nonprofits have gotten more efficient. Partners in Care is a group of essentially every organization that is working on homelessness issues on Oahu. And we have the highest housing costs in the nation. We have the lowest wages in the nation when you factor in cost of living. And not surprisingly, we have the highest rate of homelessness. And that homelessness rate had been going up and up and up. Finally, last year, we started the downward turn, and I think that is directly attributable to the work of Partners in Care, bringing everybody together and having increased coordination. So you would have people who were homeless that would go see multiple service providers with no coordination whatsoever. Now they have a list that they call the by name list that is like each individual person and all the groups that are helping that person are communicating.
That took forever to get to that stage.
It took forever, and you know what? There is still a whole lot of room for improvement, which, you know, I think is a good thing. I mean, we have been getting better, and we have the opportunity to do even more in the future.
Since you brought up nonprofits, I want to go to another viewer question. The housing crisis, the homeless population. How will nonprofits that help Hawaii's homeless population be impacted by these cuts? Can we really afford these cuts now? I want to jump into there.
So one of the proposals in the budget was, I believe, a 30% cut to public housing, additional cuts to homelessness services. I mean, we are already hurting. And so, as Micah mentioned earlier, kind of any even little hit, I'm not going to say it's going to be a crippling blow, but it's going to be hard to absorb.
Yeah, and that's money for voucher support, money for renovation of existing public housing projects, federal public housing projects, on down the list. It's clear that given how dire things are right now, that sector can't afford those kind of cuts. You know, it's an interesting thing because that ties into the healthcare equation too. We know that homelessness is an incredible risk factor for poor health and causes greatly increased expenses. So one of the, it's gaining in recognition now that one of the best solutions for people's excessive emergency room use and hospitalization is getting them a place to live. We spend $3.5 trillion in the United States on medical care each year. And which is vastly more per capita than any place in the world, but we don't actually spend as much on social services like housing and education for children and the like, compared to most of the countries that have far lower medical expenditures. So we've chosen to spend it on the medical side. It's not having a great outcome. We're failing. The United States is 47th on the list of developed countries in terms of how we're doing on most of our indicators of health. So we're not getting, back to that question of efficiency, clearly what we're doing right now as a country is not working well. Hawaii, on the other hand, is a pretty great example of something that is working. We have the best health outcomes in the country. They're not shared by everyone here in Hawaii. That's the biggest problem. Depending on where you live and your ethnicity, there may be as much as a 14 to 20 year gap in how long you live. That shouldn't be acceptable for any of us. Yeah. But despite that, overall we have very good health indicators and at very low cost. We're one of the most efficient states in the country in terms of spending. Why is that? Well, it's probably, one of the things is that we've had a lot of people insured here for a long time now, thanks to our Prepaid Healthcare Act.
Let me move on a little bit. Comment from a viewer. It's not a matter of redundancy with nonprofits, but an issue of more nonprofits needed to deal with decreased funding. I think the panel would probably agree with that. Couple of questions about what to do about this, both I think kind of directed to you, Mike Akani of Hawaii Community Foundation. How do you plan to fill the gap when state-fed monies run out? I don't know if it's going to run out, but it's going to be dwindle. And how can nonprofits increase their private donations during the time of shrinking funds? Is there hope for more money from people donating? Or?
Well, I think we're making it very clear that the magnitude of funding that we're dependent on from federal government here in Hawaii is so large that philanthropy will never fill that gap. It's not going to happen. And so, as Gavin said, I think it's going to force us to look within and to start prioritizing how we're going to make it work here. And we should look at it as an opportunity. There are a ton of low-hanging fruit that we need to go after, housing being one of them.
When you say low-hanging fruit, what do you mean by that?
Well, I mean, we recognize that one of the biggest challenges for a family to survive here is to buy a home.
Affordable housing.
And we know how to do that. And you have over 8,000, healthcare workers and teachers that are dependent on federal assistance to live here. So those are things that we can solve here locally, and we should be paying attention to those things.
Is there any stomach that you see or within our state government to find ways to at least backfill some of the losses from the feds? I mean, politically, do you see our state legislature and government stepping up funding for nonprofits?
I think one thing that needs to happen is the general public needs to better understand where we spend money. I would say that we as a state, we haven't done a particularly good job making that transparent. So that, because I think people would say homelessness is a huge priority, for example, but what percentage of our state budget do we actually spend on solving that problem? It's a tiny percentage, but does anyone have good numbers on that? The more that we're educated about that, the better we can make good decisions, I think.
Kevin, you wanted to say something?
Well, one of the things that we're doing, we're creating, with support from HCF and a bunch of other funders, we're creating a Hawaii Budget and Policy Center to really do just that, to really dig into the state budget and figure out how are we generating our revenue? Where's that coming from? Hawaii is taxes people in poverty at the second highest rate of any state in the nation. Why are, with people who are already struggling to pay the rent, why are we taxing them? So where's our money coming from, and then how are we spending it? With the idea being, let's figure out what we're doing, where we've been all these years, what we can learn from looking at that history of revenue and spending, and plot out the future. Does what we've been doing align with Hawaii's values? Are we making intentional decisions?
Right. Well, I think that you're making an important point that is what part of Appleseed's mission is sort of shifting the tax burden so that you maybe raise more money, but basically if the poorer people are able to have less taxes, they can take care of themselves better and so on. But I mean, my question is, what's the appetite in Hawaii state government for things like that, or for actually increasing? Yeah.
Yeah, I think we're seeing a definite outreach on behalf of elected officials to work with the nonprofit community, ask for guidance. In fact, when this Center for Budget and Public Policy was launched, Gavin and I made a request to come before the elected officials through Representative Scott Psyche and Senator Ron Kochi. We had nearly 40 elected officials that gave us their audience to talk about the center and the impact that it could have as a resource to them to better understand how they're spending the existing resources and to be a resource for them going forward. What was interesting that came out of that, because there's 42 other centers around the country, we saw it as an opportunity to spread the word about the things we are doing well. In fact, Representative Della Baladi made that a point. So, I mean, it's not just about, bringing resources in. It's about, let's tell the world about the things we're doing great.
Right.
And so it brought a different dimension. So I think to answer your question, I think there definitely is a willingness to work together.
But you know, it's interesting though. I mean, I think every sector is going to think their issue is the most important, because I can certainly tell you the nonprofit sector, I mean, the environmental sector thinks that not enough is spent on environment, right? I mean, less than 1% is spent on DLNR, and every year we lobby that more is spent on the environment. So, but really the biggest spending is DOE. So I can certainly tell you if there was someone from education here, they would tell you that that's not enough there. And that certainly comes up, that we should make sure that our classrooms are cool, and I mean cool, and that they're air conditioned and our children are taken care of. So I think the budget is very, very hard. You know, that's one of the hardest things probably to do every year. And I can tell you that the people that work on the state budget, I mean, you've been in administration, is a very, very hard thing to put together. So I think, and I could just sort of kind of switch topics for a bit. As someone who does work with a lot of nonprofits, for me, one of the hardest things, and maybe it's just me, and maybe it's being Hawaiian, or maybe it's not, I have a very, very hard time asking people for money. Like, it's something that I'm just not good at. I have a very, very hard time going to funders and asking them to donate. I'm terrible at it. But I think we do have a lot of people that we don't tap well enough in this community. I think we have, you know, over 10 million visitors that come every year that I think would give to Hawaii if they knew that there was need. And again, I mean, I think I've been very fortunate, as I know others have, that there are people who come here and have taken me under their wing, and others, on how to make us better at philanthropy. And I think that's something that as a community, as a nonprofit community, we need to get better at. You know, all of these visitors that come, there are very, very wealthy people who have homes here, who are interested in Hawaii, who I think we need to just broaden that scope of people who care about Hawaii. I think when we talk about the people who are interested in Hawaii, we need to broaden that net. So I think there are things we can do where we're not just thinking about tapping those who live here, but those who are interested in here, those who have a vested interest in seeing Hawaii succeed. Because I think that's not something I've seen, as someone who works with nonprofits, us tap into enough.
You know, we wanted to go into another sort of semi-policy area for a moment, and that is the changes in the tax code that could affect giving that we were talking about. I've got a quote here from a nonprofit advocacy publication, the Nonprofit Times, which cited Hawaii's experience with its own tax code in this area. And what it found was that elimination of funding coupled with changes to the tax code that could eliminate the benefits of a charitable tax deduction is a 1-2 punch at the state level. President Trump has been quoted as saying taxpayers who currently deduct giving at the 39.6% rate will see that cut to 33%, but will limit deductions to $200,000 per couple. The legislature in Hawaii tried to close a budget deficit on the backs of nonprofits by capping itemized deductions starting in 2012 at $25,000 for individual adjusted gross incomes of $100,000, $50,000 per couple, and so on. And according to a report by Common Good, total giving reported as itemized deductions increased, but at a pace of nearly 5.5% less than the national average in a recovering economy. But the numbers dropped from 2012 to 2013, 626 million to 609 million. Basically saying, you know, messing with the tax code and that could really impact giving. What concerns do you have about the kind of tax reform things that are being proposed at Washington could trickle down and affect the nonprofit charitable sector here?
You know, the history has been real mixed. You know, what we're finding, at least here locally, that the charitable deduction, while we want to maintain it as it is not the driver of why people give. People give because they're inspired about what they're trying to impact, and they're not usually thinking about a tax impact there. That's been our history, but at the same time, you know, we want to protect the charitable tax deduction to where it's at today.
Another potential change that's being discussed is eliminating the estate tax, the death tax. And I was just reading some materials on that and the impact that could have. And while people really don't necessarily give to get the deduction, It is some incentive, and
You get a little reward at the end of the year.
right. And so if people are now able to pass on everything that they have to their children with that estate tax is pretty significant. It's a big chunk. I don't know if it's 30 cents on the dollar or 50 cents on the dollar. It depends on the size of the estate. But that's a huge incentive to really think hard about how to make the most of your money, I guess. And if it's given to your kids and extended family versus giving to some cause that you really believe in, it definitely moves the needle, that change.
Yes, Dave Doroff, does your organization, it's a community health clinic, you bill for services to Medicaid, Medicare,
Yep.
and so on. That's the bulk of your revenue, right? Do you have an opportunity to go outside that
Absolutely.
box?
So about half of our revenue comes from that and federal grants. The other half comes from charitable giving and grants from philanthropic organizations.
Really?
Yeah.
So
but we're a little bit unusual in that regard as a health center. There's about 1,200 health centers across the United States. Most of them are driven primarily by the revenue streams of Medicaid and Medicare.
So what's your trick?
So we have just focused for 45 years on community health as opposed to just the four walls of the exam room, and have found that investments in that space pay off in the long run. I'll give you an example. Is our elder program. We provide comprehensive care to about 850 homebound elders in the Kalihi community every year. And needless to say, allowing families to keep their elders at home saves the state tremendous amounts of money. Saves the federal government more money, actually. As we know, that's a huge expense for Medicaid, about $150,000 a year to go into a nursing home. We have an incredible track record at reducing people need to move into long-term care facilities. So a small program is actually pays for itself many, many times over.
What's
and
the
yet
revenue to that program?
That program has a budget of about probably about $400,000 a year, and yet that's a hard $400,000 for us to cobble together every year.
So you go out and you ask for donations for that specific program?
Yeah, grant funding, and it tends to be cobbled together from multiple sources, and every year we go back to find new sources. And so it's not. It's craziness. It should be that someone's would be coming to us and saying, "You guys are saving us a whole lot of money here. Could you do more of that?"
Yeah,
but that never seems to happen.
Tricia Watson, when you advise nonprofits about their business models and so on, I mean, how many of them have that ability to identify a need that is so attractive that it brings in that kind of donations?
I think they all have the capacity. I mean, the need is there, but it's the capacity to have the staff to go and do it, to execute. I think, all nonprofits have something wonderful they do, but it's really having the staff to have the time to go and do that sort of advancement. That's the challenge. Nonprofits need to be doing their work, not necessarily having the staff to go out and, do the work to go get the money. That's more often the challenge. I think nonprofits always do wonderful things. I've never seen a nonprofit that's not doing something wonderful. They don't have the time to go do that.
One of the difficulties, Daryl, and maybe the doctor can speak to this, is that so many times, the funding is not in direct alignment with the services they want to provide.
Right.
It comes with strings, it's restricted money, and so the most valuable dollars you can give a nonprofit is unrestricted dollars, whether it's through a legacy gift, through a direct donation. You don't want to put collars on that money. You want to give a high-performing organization the opportunity to have as much freedom with those dollars as possible. And we're trying to do a lot more of that with us in our work, but identifying those nonprofits is not an easy thing.
I would absolutely say that kind of money allows us to be really effective and creative, and it's very rare.
It becomes a tapestry you're trying to put together, and with very little resources and expertise to do it. I mean, a lot of these federal, state grants are. They're complex applications. I mean,
Yeah.
Tricia probably
You
fills out a lot of them.
and you can spend a lot of money going after
Yeah.
the grant and not getting it. And once you get it, administering the grant and administering the complex metrics that are not relevant for the community that you're serving, they're going to ask you, why in the world are you measuring these things? These aren't important to us.
We've got about 5 more minutes, and so I want to quickly go through some of the questions we have, and these are kind of around the map, so let's just
So it's
throw
a
them out
lightning
there.
round?
Kind of. Well, the lightning round comes later. This is
okay.
still pretty leisurely. We have booming tourism, low unemployment, yet lawmakers always say there's not enough money. How do we absorb this? I guess it'd be. Anybody want to?
I don't know what that means.
Should we be taxing the tourism more? I mean, would that solve a lot of problems?
I mean, it couldn't hurt. One of the advantages that we have, I guess, is the exportability of some of our taxes, so that local residents don't actually have to pay it. And in a lot of ways, that makes sense. I mean, when you're coming here and visiting, I mean, you are taking something away from Hawaii. And so requiring folks to give back to some extent. You know, we have the lowest property taxes in the nation, and so there's a lot of people talking about how that likely is leading more people to invest in vacation rentals here, and should property taxes on those non-residents, vacation home buyers, should those be higher?
No doubt, rather than trying to raise taxes on one of our most dependent, parts of our
Goose that lays the
economy,
golden egg.
I think we need to start focusing on diversifying. I mean, we live in one of the most interesting, places in the world, and we are attractive for research and development, and we just don't tap it, and so there's so many opportunities that we can dive into to diversify where our income comes from.
Another question that for Tricia has come, but I think this is a good question for everyone. Why do you think our delegation can protect us when they are all Democrats? I think that what you were trying to say was more like the whole of Congress is more likely to be softer on this sector than the president.
Well, one, I think our senators in particular have done a very good job working with the Republicans. So I think even though they're Democrats, I think they've done a good job working across the sector. And I think it's also, we're nearing midterms. So I think people need to remember that cuts would hurt across the country. I mean, I think, just like these, even if they're Republicans, they have programs in every state. So just as they would hurt Hawaii, they would hurt, these cuts across the board would hurt programs in every single state. So I think representatives are everywhere in this country. So I think that's, I think representatives are everywhere, and I think people have to work together.
They've got to go back to their district.
They have to go back to their districts. So.
This is a very interesting question, and because politics is always a matter of priorities, right? How are low priority nonprofits, I'm sure they don't consider themselves, such as arts and culture, surviving compared to high priority nonprofits such as healthcare and housing? Are you seeing some nonprofits likely to struggle more than others depending on their mission?
In that area specifically is probably one of the most challenging areas. I think across the country, you're seeing nonprofits in the arts and cultural sector start to reinvent how they're positioning themselves. They're connecting themselves to education, they're connecting themselves to the environment, they're connecting themselves to other areas that allow them to have better traction. And
to health. I'm actually going off to Washington, D.C. to a conference at the National Academy of Sciences about art and health in November. So, I mean, I think it would be a mistake to assume that those things are just add-ons, that they're somehow not relevant for
luxury.
They're luxury items, right?
They're getting traction.
And I'm president of the Kalihi Palama Culture and Art Society, and we actually have our biggest year. So, and part of it is we've partnered with Japan. So we do keiki hula. So we've, if the U.S. doesn't want to fund us, we have friends in Japan. So I think it's about...
It does require flying to Japan, though, doesn't it? Or...
It's okay. It's not that far. But I think it is, again, about thinking about, where are places that will support you and partner with. So, I mean, I think it is about getting creative.
Now, there's still some cynicism out there in our audience, which I give them credit for. Is there a government agency that audits nonprofits annually? Where can one get the info on salaries of the people who run nonprofits? Those rich
GuideStar.
nonprofit people.
Yeah, GuideStar 990s are available online in a number of places. And audits, the organization I work at is audited umpteen times every year.
By multiple agencies.
By multiple different agencies. I wish, in terms of efficiency, that they would all agree to accept one audit, but we're audited over and over and over again, to the point that some of our programs, particularly accounting, has little time to do anything other than respond to the audits. And I think that's true of the nonprofit sector, especially large nonprofits are scrutinized to a very high degree.
Yeah, but there's also a sense out there maybe that they don't know enough about what they're doing. I mean, do people know enough about what all these nonprofits are doing, or they only just know what's in their little world that they're aware of? You know?
What do you mean?
Well, it's how they market themselves to the community to be able to attract this kind of stuff. A lot of them don't have marketers.
Well, I think the larger nonprofits certainly do.
The big ones do.
Yeah, I mean,
Yeah.
and I think it's just a matter of there really isn't funding for marketing most of the time, and I think people are very busy doing the work, but I think...
We're out of time.
Okay.
Okay. I want to thank all of you for joining us, and mahalo to our guests, Micah Kane from the Hawaii Community Foundation, Dave DeRoff from Kukua-Kalihi Valley Clinic, Gavin Thornton from the Hawaii Appleseed Center for Law and Economic Justice, and Tricia Kehaulani-Watson from Honua Consulting. Next week on Insights, the recent Marco Polo high-rise fire took 4 lives and caused more than $100 million in property damage. It also amplified the discussion about sprinkler systems and other safety issues for Hawaii's thousands of condominium dwellers. Will there be mandatory safety upgrades for older high-rise property? And has the Honolulu Fire Department provided enough information about what happened? We will follow up on the aftermath of Hawaii's worst high-rise fire right here next week. I'm Daryl Huff for Insights on PBS Hawaii. Ahui ho.